I'm Jim Pollock, CEO and co-founder of LumenAstra. We are commercializing a patent from the University of Colorado for a passive, wearable, non-invasive sensor that can measure internal body temperatures several centimeters below the skin surface wherever it's placed. True core body temperatures can only be measured today using highly invasive catheters. Clinical and consumer thermometry have not changed in over 40 years. We are developing a radically different sensor that creates new opportunities for surgical outcomes never before possible. Here's an example. Our beachhead application is monitoring brain temperature during the deep cooling required for the world's third most dangerous surgery, aortic dissection repair, which has a 17% mortality rate and a 66% chance of cognitive loss. For this surgery, the brain must be cooled to 14 degrees C, allowing enough time to shut off the blood of the brain while the aorta is repaired. Today, nasal or bladder temperature is used as a surrogate since there is no way to directly measure brain temperature. With our sensor, we can cut the time at cold and surgical time by 10 to 15 minutes, reducing the mortality rate by 20%. We are starting discussions with manufacturers of patient monitoring and cooling systems such as Medtronic, GE Medical, and Terumo Medical, as we see a great opportunity to white label our sensors as replenishable sales. After penetrating major surgical centers with this high-value proposition, our much larger follow-on markets include infants with hypoxia ischemia and monitoring critical brain temperature for 2 million patients annually in ICUs after cardiac arrest, stroke, and brain trauma. As a deep tech startup, we have raised $3.1 million in non-dilutive grants from NSF and U.S. Army, who is extremely interested in early warning of heat stress, claiming thousands of casualties a year. We also have a strategic relationship with Braun consumer thermometers, as they see our technology as a huge improvement over infrared forehead scanning, which has been the norm for the last 30 years. We have a terrific team at LumenAstra. I'm an MIT geek with 8 early-stage companies and 5 successful exits. Our CTO is CU Distinguished Professor Dr. Zoya Popovich, who is the inventor and our co-founder with a Caltech PhD. We have completely transitioned the technology out of CU into the hands of the most talented engineering team I've ever worked with. We have 2 PhDs from the CU Microwave Lab and Gilla Physics Lab for our core technology development, and 2 senior mechanical and electrical engineers with 40 years of industry experience mastering our FDA regulatory and back-end device design. So why Destination Startup? We have reached key milestones in our prototype development, allowing angels or early-stage VCs to safely invest alongside our grant funding with 14-month runway to take us aggressively into commercialization. So thank you, and let's start those conversations.